Hi, everyone. Welcome to the Jobskin webinar series for 2024. My name is Adam Ho, the Managing Director at Jobskin Australia and New Zealand. And with me today is Rosemary Kendall, our Clinical Advisor based in Australia, as well as Veronica Eichmann, our Clinical Advisor based in New Zealand. Today's topic is about fabric selection and how that affects your garment prescription. And then with that, I'll hand it over to Rose.
Hi, everyone. Thanks for joining us today. I think Veronica and I were pretty chuffed when we came up with this idea for a webinar because oftentimes this is one of those things that comes up where if everything is just kind of stock standard, no problem. But when you start getting some challenges, it's hard to know whether you need to modify a garment or whether you need to incorporate some additional options or whether actually just choosing a different fabric might suffice. So hopefully this will provide you with a bit more information or an extra tool for your toolbox when you're going about garment prescription. So now we were just saying before that team seems to have
Rose, you're muted.
I think you muted yourself.
Yeah, I can't. It won't let me advance a slide.
Could you press the key, like the left right key?
Yep, done that. Gone up, down, and what it's doing is it's changing something on my. Oh, there we go. There we go. I don't know how I did that. I clicked on the same. Everyone can still hear me?
Yep.
Yeah, because when I used the arrow keys, it was just turning the mic on and off or the camera on and off. So I'm not quite sure what was happening there. All right. So look, what we're going to cover today simply is why fabric selection matters. That's kind of a given as to what we're talking about. Briefly touch on calculating compression for pressure garments. I suspect that probably everybody here, this is going to be familiar, but when we start talking about different fabrics and how they behave, we need to keep this in mind. So it's a very brief overview. Then I'm going to talk about the fabrics that Jobskin has on offer and which I've classed as the primary fabrics and some secondary fabrics and then linings and then some, additional ones that don't seem to fit any of the other categories. And then we're going to come back to sort of where we're starting with why fabric selection matters and just consider selecting the most suitable fabric. What are the requirements that you need to take into account and whether anatomical locations make a difference? Okay, so why does fabric selection matter? There's a whole range of reasons, and the very obvious one is the purpose of the pressure garment, whether you are containing advanced lymphedema or whether you are dealing with a relatively minor scar. There's a huge spectrum in between. The type of garment that you are needing, whether it's a sock or something to cover breast tissue or going over the shoulder or the upper limb, the level of compression required because different fabrics are capable of achieving different levels of compression, the anatomical location of the area that you're wanting to cover, and the proportion of the anatomical site. So whether you've got very lobular tissue or whether you've got a beautifully proportioned lower limb. The conformity that you require, so that's particularly so, or by way of an example, with the head and neck, because getting good compression around something that's basically the shape like a ball is a bit more challenging than getting good compression around a cylinder. The state of the skin, so how friable the skin is, or conversely, how robust the skin is. Whether you need to modify a garment for donning and doffing, because sometimes changing a fabric might provide a reasonable solution. Obviously, one of the things that we take into account probably every day of the week is the climate in which somebody will be wearing their garment and their ability to regulate their own body temperature. And then just specifically, sometimes we're wanting to target specific areas. or maybe there's areas that we need to apply a higher level of compression. All right, so let's just quickly, just very briefly review how compression is calculated, because as you would all be aware, every garment that you put on one of your patients needs to apply graduated compression. For anyone who that's a new term, basically where you have graduated compression, you have more at the ankle or distally than you do proximally, whether it's the upper limb or the lower limb. And so when you ask for a garment, say that's 30 millimeters of mercury, uh, because I've got lower limb examples here, we'll talk about a lower limb. If you ask for a garment that's 30 millimeters of mercury, you will have 30 millimeters of mercury at the ankle. If you and then say mid calf might be 60 to 80%, and then 40 to 50% by the time it gets to the knee. If it's a full length garment, like this example on the right here, so 30 millimeters of mercury equates to 24 millimeters of mercury. So, well, let's say that that actually is not full length, but imagine that you were going all the way to the thigh. It would be 24 millimeters of mercury around the knee, and then it would be somewhere between 12 and 18 millimeters of mercury at the thigh. So one of the things that, as therapists, that we need to take into consideration is whether reduced compression proximally is going to be adequate to the task that we are requiring um, of the garment. So it might be our designers actually, apart from their own wisdom, they use a software system that will lock out compression being too high proximally. But you can see in the range that if it's 30 millimeters of mercury at the ankle, you can actually request that the graduation is less, and so that it's applying 18 millimeters of proximally rather than 12 millimeters. So it depends on how much that graduation factor is. Oh, I'm having problems with moving the screen again. There we go. Okay, so a couple of other things to just consider. Compression levels are clinically prescribed, and if there's anyone on the webinar today who comes from a lymphedema background, you might be more familiar with using the term of classes, class 1, class 2, class 3, to describe the level of compression. We're quite keen to talk in millimeters of mercury because it's more specific than classes, because depending on where a garment's manufactured, like the French class system is different to the German, and then there is a European standard. One will say 25 to 32, one will say 29 to 34. So if you feel confident to use millimeters of mercury, that's a helpful thing. Now, depending on the systems that a garment manufacturer uses, there can be Laplace's law used to calculate the level of compression, or a reduction factor. A reduction factor, simply put, imagine you had a circumference of 100 centimeters. The reduction factor might say, well, we reduce that circumference by 20%, so that comes down to 80 centimeters, and that will allow sufficient compression to be exerted. That's a fairly simple way to do that. And most CAD programs, software programs, also incorporate the use of Laplace's law, which is how pressure behaves around a cylinder. And you don't need to know specifically about that, but I mention that today because I think it's important that we consider levels of compression and how different fabrics behave, because they definitely behave differently. We also kind of add an extra factor in there where we consider different weights of our PowerNet and our PowerTex fabrics, and you might hear it described as the gram tension weight. And sometimes that means that a patient might receive a garment that feels slightly different because the weight of the fabric is different, so that impacts the reduction of the fabric, but the same level of compression will be exerted. You don't have to worry about the specifics of that, but if you're interested, that's certainly something you can discuss with the designers. We are also now trialing a new fabric that is one that's used by Jobskin UK, where they have a far less range in the gram tension weight. And so that will simplify that process and it changes our design process. But you might see a rolling change with that and you might hear talk of that, but just so that you're aware of that. In terms of what we're going to discuss today, there's no difference specifically about the feel or the look of the fabric. So we have three main fabrics that we use for our garments. Conformtex, which might be new to some of you. PowerNet, which is our standard bread and butter fabric that we use. And then PowerTex, which is a heavier weight and a little bit more durable. So I'm going to go through each of those fabrics today. Oops. Oh, now going back is going to be a problem. Oh, there we go. So what I just categorize as our primary fabrics are those three, PowerNet, PowerTex, and we're going to be introducing Conformtex for those of you who are unfamiliar with it. We have a secondary fabric which is called CDA, and you won't find that on any of our literature, but it's helpful for you to know about because it is useful, but we never want it to be used as a primary fabric, so we don't publicise it a great deal. We've got three main linings, cotton, satin and Cylon-tex, and then the additional fabrics that I'm going to mention are mesh, fabric, and then an electroconductive fabric. Some of you may be aware of all of them, some perhaps very little. All right, now the three primary fabrics. The first is the PowerNet. As I say, it's our standard bread and butter fabric. It's a fine mesh-like fabric with inbuilt tension, has tensile properties. That tension is graded with the gram tension, and it's a fairly soft fabric, but it is reasonably robust. And I've just put three examples here. I particularly like the one of the head here because you can see that it still conforms reasonably well, but it provides good tension, good and applies good compression. You can see it's versatile, that it's used in well, those of you who've worked with Jobskin, you'll see we do all our garments made out of PowerNet. But then the next option up is PowerTex, and it's still that same mesh-like tensile fabric, but it's a bit coarser. And so that makes it a bit more durable and it's capable of higher levels of compression. So we actually can make a PowerTex garment up to 70 millimeters of mercury, although that certainly would be the exception rather than the rule. There is no chance that we could ever achieve that with PowerNet. So it really is a stronger fabric. And as I say, more durable. So particularly if you have got people who are, say, tradies who are, quite physically heavy on their garments, you can actually opt to choose PowerTex over PowerNet if you think that that's something that would extend the life of the garment. So, and then just introducing our third primary fabric, Conformtex, which is a very, as the name suggests, a very closely conforming fabric in its fit. It's a close weave fabric, so it's gentle and non-abrasive. What I would say about the PowerNet is that it's actually the PowerNet and the PowerTex, because we have got quite a fine weave, it is generally not abrasive. Whereas if you go for a like basically bigger holes in the PowerNet, in a PowerNet type fabric, it feels a little bit more like fly wire, I would describe it as. So PowerNet and PowerTex are actually quite soft, but this is kind of next level softness, but because it's very closely woven. Because it's closely woven, though, it can be, it lets less air in and out, so it can be a little bit warmer. It really is very useful for avoiding shearing when you're donning or removing a garment. So it's fabulous for friable or newly healed skin. It makes a really awesome interim garment or first garment for following burns or skin grafting. It actually, beautifully, it's a UPF 50 plus, which is awesome for us living in our part of the world where sun can be a problem, because the majority of compression fabrics absolutely are not SPF. But that's one of the trade-offs, is it has to be a close weave fabric to achieve that. It holds its shape very nicely. And it's cooling because it actually wicks moisture away from the skin using what the manufacturer of this fabric calls their catch, move, release technology. And as I mentioned, it's an ideal first garment. And even so, even though it's softer, conforming, it is still capable of delivering therapeutic compression. This is a face mask that has been made with the Conformtex, and I was actually helping a therapist with a patient who had lymphedema in the head and neck, but it was mainly on the cheek and sitting under the eye, and she was very, very unwilling to wear, or reluctant, is a better term, to wear compression. And so we decided as a first pass we would try her with Conformtex because it's lighter weight. It's a little bit easier to don and doff, sort of maybe a bit more palatable. Well, this was a very good learning experience for us at Jobskin because it was incredibly effective at controlling this lymphedema over the cheek. And as we've experimented with this new fabric a little more, we've realised that we can actually have considerably less seaming. As you can see here, there's no reinforcement that's required around the eyes, nose and mouth. That can be simply, provided it's sized and cut properly, it can be left in its raw form like that, which makes the garment less obtrusive. Now, moving on to the secondary fabrics, the one secondary fabric we have is CDA. And I have got no idea what that stands for. I don't know if it stands for anything. We've never been able to determine that. But if any of you have ever ordered a lymph crop vest, it's the fabric that we use to line or to reinforce the walls so that we can increase the level of compression, but that it's a very smooth fabric, a little bit heavier in weight than PowerNet, but it holds itself, it's a little bit less stretchy, so it holds itself quite firmly. I've used this as part of panels in a garment. I recall particularly somebody who had a very large burn and had lots of breakdown over the shoulders and was extremely anxious putting a vest on and off. And despite zips, when we would pull the arm sleeve up and go to lift the garment over the shoulders to then zip it up at the front, every time this gentleman would say, no, I'm really worried about my shoulder. No, don't drag it over the shoulders. Very, very anxious about potential back breakdown. So that top panel that kind of extends just over the deltoid, the shape of the deltoid, was exchanged on his vest just for CDA. It was firm enough to still behave consistently with the way the pressure was being exerted through the rest of the garment, but it was smoother and much easier for the patient to tolerate. So we don't make a garment, a full garment out of CDA, but you can put in some panels as an alternative. Okay, moving on. Selecting the right lining. Now, it's very hard to show lining in a PowerPoint, I have discovered, but the three linings that we offer is, the first is a cotton lining, which is basically, it's almost like some of the fabrics that you find in that's used in underwear. It's it's cotton, so it's obviously not a synthetic, so it's a bit kinder in terms of heat, and it's a very comfortable fabric to wear. Satin also is satin is an extremely comfortable to wear, but it is a synthetic because it's not actually satin, it's a satin finish lining. And the skirt on this little girl mannequin here is made out of the satin lining, and it's really, well, I would describe it best as more like bather's material. So it's got that slippery finish to it. So if you've got areas that say like an elbow that's perhaps a bit friable or difficult when you're donning the garment, satin in there is very helpful. And then the third lining that we have, which I'm sure most of you are familiar with, is Cylon-Tex. It's 0.5 millimeter thick, but it is a silicon lined fabric. So that can be stitched into the garment over specific areas that you want to target for scarring. It's a very cost-effective way to apply silicone because while it's a costly expense when it's stitched into the fabric, it lasts the duration of the garment in probably 98% of cases. And it's so much easier than mucking around with gel sheets undergarments, particularly things like gloves. We have got some specific guidelines for Cylon-Tex because you cannot fully line a garment with Cylon-Tex. You would never get it on. Would be like trying to put on a rubber garment. And we generally, the manufacturer says maximum of 50% circumference. We would say probably 30%, but we've got a lot of tips and tricks to help you get around that if you've got areas and that are larger areas that you want to address. And we have got a webinar that's on the Jobskin YouTube channel, which is specifically about Cylon-Tex. So if that's something you need a bit more information about, then you can follow that up there. And moving on to the additional fabrics, we have got mesh, which we generally use in the crotch or under the axilla. There is no tension in the mesh fabric, so if you ask for mesh there, you do need to be aware that there will be a compromise to the compression immediately around it, so you wouldn't use it in an area where you have to maintain the integrity of that compression. But if, for example, you had waist-high tights and the compression essentially was needed up to the thigh and you were using the waist component or the torso component of that garment for anchorage and stability, then by all means use a mesh crotch there. Then we have the electroconductive fabric, which is incredibly cool on gloves. Because it enables people to use their smartphones, their iPads, their touch screens on their computers without removing their gloves. You and I all know that when a glove comes off for functional tasks, it can be somewhat delayed in going back on. So if there's a way that we can enable people to do everything that they normally need to do in a day without removing it, that's fabulous. So you just need to request that as an addition. And if someone's really only needing it for using their phone and they tend to use their phone just with their thumbs, just get it stitched on the thumb pad, or maybe you might want thumb and index finger. Now, this is not a fabric, but I thought I would just mention this quickly just before we finish up. But we also have a range of foams. We use Vel foam, we use thin foam, we use memory foam, we use a low and high density foams of varying thicknesses that you can use to target compression, to fill defects, to even out compression. For example, if you're trying to address scarring that's, say, posterior to the lateral malleolus or inferior to the lateral malleolus, you could stitch a C-shaped piece of foam around the malleolus so that you get good therapeutic compression. But if you're unsure about what foam, you don't have to request a specific foam, but if you're unsure, you just need to explain to the designers what it is that you're trying to achieve, and they will either workshop it with you, or they will select the most appropriate foam that's for your purpose. So going back to, so how do you choose? Well, based when you've got the knowledge of the fabrics that are available, we then come back to exactly what I spoke about at the beginning, the purpose of the pressure garment, what type of garment you're needing, the level of compression. For example, if you needed higher levels of compression, Conform-Tex is not your fabric. It's just never going to achieve that. Where the anatomical location. So, for example, for a head and neck garment, you might be tossing up between the power net or the Conform-Tex. You might start with Conform-Tex and move to power net. The proportion of the anatomical site, as you know, where there's a lot of creasing, you can't use a soft fabric without a body, otherwise you risk causing tourniquet. How much you need the garment to conform really closely, the friability of the skin, whether you need to accommodate modifications for donning and doffing. So, for example, I wouldn't be putting lots of zips in Conform-Tex because it's going to affect, the zip is going to have more body than the fabric itself, and so any kind of curving of the zip is going to affect the compression. Climate thermoregulation, the Conform-Tex is light, but it's a close weave. PowerNet and PowerTex they allow a lot more movement of air through the fabric, so they're generally cooler. And then whether you're wanting to target compression or whether you're needing to add additional compression panels. For example, some of you, it depends a bit more whether you work within lymphedema or not, but you may have seen at the conferences the bariatric torso band that Jobskin makes, which is particularly useful for an abdominal pannus, and particularly where there's abdominal lymphedema. That for a very large person, we need obviously very robust compression with a very strong fabric. So generally what our designers do is that they line the garment with PowerTex or sometimes with CDA, and then they use PowerNet over the top. So there's still the color choice, but it becomes it becomes a more robust garment that's capable of holding far greater volumes of tissue. And we can, depending on how that garment is stitched in, whether it's, not garment, fabric, whether it's stitched in on the bias or stitched in as a double layer, we can target compression or raise the levels of compression in particular areas. All right. As always, we have a range of resources under support and training, and the Jobskin YouTube channel, which I forgot to put on this slide, is also very helpful because we have specific webinars that we've done in the past, like how you can achieve compression in the lower, in defect areas or using Cylon-Tex, that sort of thing. Veronica and I are here to help you, as are our awesome design team. So with that, I'm going to hand this back to Adam and Veronica and see if any of you have any questions or conundrums that you might have encountered.
Cool. Thanks for that, Rose. Yeah, anyone, if you have any questions, feel free to unmute your mic or type it into chat, and then we'll try and do our best to answer any questions that you might have.
Sorry, Rose, I've got a question for you, if possible.
Yep.
It was in relation to where you were talking about calculating compression, and you mentioned that as a therapist, we have to consider whether reduced compression be adequate to the task. So in terms of deciding the millimeters of mercury that are appropriate, is that something that is sort of our role in terms of us needing to upskill to prescribe that, or is that something that's, I suppose, at your end and then we sort of just explain the situation to you?
Generally, we have some clinical guidelines that Jobskin has developed over time, and it's based on evidence. So the current evidence, we're about to go down a big rabbit warren. Can I just forewarn you about? because
That's all right.
because let's say in burns, the standard compression is 25 to 30 millimeters of mercury. Now, when you know that compression, and there's theories that it's because it's above capillary pressure, and there's a a bunch of different things floating around out there. When you consider the fact that you are, if in order to have a graduated compression garment, which you absolutely must have to support the the fluid flow from distal to proximal. You cannot not do this.
That makes sense.
The reality is, if you have 30 millimeters of mercury at the ankle, you are going to have less proximally. And so that kind of defies a lot of the theories about clinical compression. Because if we say, oh, you need 30 millimeters of mercury, are we saying 30 millimeters of mercury all over the body? Are we saying that's the minimum? So does that mean we should really be 50 at the ankle, and so that we have 30 at the thigh? You can end up really, this is the rabbit hole, because you can go round and round in circles going, I can't work this out. It doesn't make sense. But what I can tell you is that we prescribe a garment compression level, and we just kind of let the design team work out the rest. And we trust that when the evidence says 30 millimeters of mercury, they are specifically talking about the level of compression that's applied at the ankle. So that I think the capillary pressure thing is a little bit of a red herring, and that's what sends you down the rabbit hole. Now, in terms of you needing to say what compression you want, no one in the factory is a clinician. And you are the clinician who is working with your patient, but we do use evidence-based guidelines. So, for example, it's really important on the form that you put the diagnostic category. So if you are wanting a garment for burns or for scar management, if that's all you say, if you don't nominate the millimeters of mercury, the designers will assume that you are working on 30 millimeters of mercury. For something like a vascular complaint, or for edema or lymphedema, we do rely on you nominating the level of compression. And we have got some kind of standard guidelines that we can forward to you, that we generally, they're kind of like fairly basic clinical guidelines. And if you are working in vascular edema, lymphedema, the rule that of kind of thumb for practice in those areas is that you start with a standard level of compression, which would be a class 2 or a 30 millimeters of mercury. And if it is failing to do what it needs to do, then you go up. You don't look at somebody. I hope I'm not being too kind of teaching you to suck eggs, but we don't look at a patient and go, "Ooh, that looks pretty bad. I think I might start with 50." Like we move up through in 10 millimeter increments. We move up through the levels of compression based on how the tissue responds to the compression that's gone before. Does that answer your question?
Yes, no, it definitely does, because I think it was sort of, as a clinician so far, you are sort of going by, I suppose, for want of a better phrase, trial and error, going gradually from less compression to more. And I just wondered if there was a specific, not a recipe, but you know what I mean? Like, I wondered if there was a specific thing that we should be doing in terms of asking you or us determining the pressure, that sort of thing. So that's helpful. Thank you.
Yeah, and we have got like our basic chart that we can make available to you after the webinar. And one thing I would say is, because we require a date of birth for every patient, if you have an elderly person, say, who needs compression on their upper limb, that compression will, or I think the age is 72 or maybe 75. I would have to check with our design team. The compression is automatically reduced to accommodate the likelihood that there may be some compromised circulation. So that's basically a safety net. So you don't have to stress about that, but that's why it's so important to us that we get a diagnostic category or a diagnosis and a date of birth.
Yeah. Awesome.
Okay.
Thank you so much. Thanks, Rose.
Pleasure.
Yep. We had a comment from Sophie Peters saying that she's started experimenting with conform text as her first garment for peds, and she really enjoyed it. Nicole Alexander said, has anyone started with conform text and then subsequently moved to PowerNet?
Definitely.
She wonders, will patients prefer conform text and not want to swap to PowerNet later, especially in peds?
Well, I don't know of anyone. I'm not sure if Veronica does. I don't know of anyone who has resisted the move from conform text to PowerNet. I think it does feel different, and I can't recall anyone, but we definitely move people from conform text to PowerNet on a fairly regular basis, the people who've been using that.
I think it's a little bit dependent on how you sell it too. Like if you're popping them into a conform text to start with, part of your dialogue might be, hey, we're starting in this fabric. If everything goes well, we'll be able to stay in it. But if it's not quite meeting our needs, then we'll be looking to pop you up to a slightly different fabric in order to, meet your therapeutic needs. So, yes, you may never have to do that. But if you set the scene to start with, then that can obviously help with any transitions. And any transitions that can be difficult, obviously, you've got things like linings and stuff or changes in garment design to help make it a little bit easier.
And I think I'm allowed to say this. If I'm not, Adam can deal with me afterwards. But for those of you working with children, we're moving towards our final stages of producing our pediatric interim garments that are actually made from conform text, because we know that ready-to-wear options for peds are negligible, and so we are developing a range. We've got vests and leggings, bike shorts that will be a really awesome way for you guys to start compression early with children. So watch this space.
That's okay. I had the button hovered over mute participant. Not kidding. I'm like, oh no, that's okay.
It's like that. What is it that saying about, it's better to ask for forgiveness than permission? Yeah.
Cool. Are there any other questions or clarifications? Or did Veronica have anything to add around that discussion previously? Yeah. Oh, good. Yeah, I'll leave a couple of seconds for any more questions or anything to we want to clarify. And if not, then thank you very much for attending the webinar today. We hope that it was useful for you. As always here to help and serve. If there's anything you want, please feel free to reach out to us. And until next time, have a nice day. Thank you, guys.
Thanks, everyone.
Thank you.